Assalamu alaikum and welcome to IQRA TV. This is your host Rabina Mir for Medicower. Welcome to the show. Today is a live show, so I'm hoping many of you will be happy to phone in and ask us questions about the topic of today. Today's topic is slightly different to our usual topics. Today we're not talking about a clinical issue, we're talking about an issue and how we can support you in the community if you're suffering from depression. So my guest today isn't here as a doctor to answer questions about depression, but she's a doctor with a PhD in research to talk to you about a self-help book that she's created and about therapies that can be used to help our sisters and brothers in the community who are of the Muslim faith who may need support with their help with their journey with depression. So let me introduce you today to my guest. My guest is Dr. Ghazala Mir. Wa alaikum salam, assalamu alaikum rahmatullah. You're an associate professor at the University of Leeds, Sister Ghazala. You've done a PhD, I believe, in the importance of faith beliefs in long-term illnesses and the management in Pakistani communities.
That's right, yeah, a long time ago.
Long time ago.
Yeah.
But alhamdulillah, today I really wanted to speak to you about the new research that you've done that seems to be of real benefit, I think, to our communities, which is really why I'm pleased to see you here today. And really grateful, particularly because I know you're not very well yourself today.
No, I am. I might be coughing throughout the interview.
I'm sure we'll manage. Your research was called Addressing Depression in Muslim Communities. So I wondered if you could tell me a little bit about why you decided to do your research on this specific piece and where did the idea come from?
So the reason that we did the research is because it wasn't just me. There was a team of us at the University of Leeds, and we worked with Bradford District Health Trust, and we worked with Sharing Voices, a community organisation in Bradford. I was also an academic at the University of York. The reason we got together and decided to do this research is because we know that in Pakistani and Bangladeshi communities, there are some people who have depression for a longer time than people in the general population. And we also know from national figures, this has come out more recently, that people don't get referred as often to primary care mental health services, and when they do get referred, they don't get as good outcomes from the therapy. So what we tried to do was follow what the Department of Health says should happen. There should be culturally appropriate treatments available. The Department of Health and the National Institute for Health and Clinical Excellence both say that mental health services should provide treatments that are appropriate for cultural groups. And the reason they say that is because the evidence shows that you get better results, and for Muslim communities quicker results, if you use a culturally appropriate treatment. So we did it for that reason. There's also some research to show that in Muslim communities, people who have mental illness tend to draw on their faith more than in other faith groups. Yeah. So from my own PhD, I knew that religion was sometimes seen as a really important support for people. They turned to religion when they had illness in their family or for themselves. Yeah. Often, more than, I knew that was the case in the Pakistani community. Not everybody, but a lot of people did. And so they saw it as a really important support for them. Sure. But sometimes in clinical settings, like in the GP or in the hospital, it became almost like a type of a sort of a trigger for discrimination. Yeah. And also practitioners, health professionals often feel really uncomfortable talking about religion, so they don't talk about it.
Even in the workplace, we're not talking. It's like the elephant in the room all the time.
Yeah, well, it's something that in public life in the UK, it's not normal in English culture or British culture to talk about religion. It's something that's separate. And this goes back quite a long way back in history, that there's been a struggle between the church and the state. So that historical struggle has meant that now it seems quite unusual, and that's really different for Muslims. We often talk about religion just in our everyday speech.
Well, we don't hide it, do we? For many of us, it's visibly part of our identity. Yeah. And for others, it's a deep thing within us, and as with other faith groups, and yet it never seems to be brought up as a way that it can be useful.
Yeah, it's quite normal in Muslim communities for people to use religious phrases. You'll start off with salam, you'll say inshallah, you'll say mashallah. All these things are quite normal for us. Yeah. And if somebody says they're ill, it's quite normal to do a prayer for them.
Absolutely. Or to ask people to pray for us. Yeah.
Yeah. So we have a different sort of way of looking at religion, and not being able to talk about that part of your identity when you've got depression is really. It's a really important thing that this research is really trying to look at and to make it more easy for people to think about that particular support.
Yeah. I really want to explore this in more detail, and of course I'm going to come on to that. I think what I want to ask you first of all is, with some of the things that you said about how we actually have this barrier, and you're not just talking about Pakistani communities, you're talking about all Muslims, aren't you, as a faith group?
That's right, yeah. So I'm talking about Muslim communities, and we know that in the UK they're the most diverse they're the most diverse religious group. So there's more ethnic groups within the Muslim community than there is in other groups. But I think what we found out about Muslim communities could apply also to other religious groups, that even Christians in the UK might find it hard to talk about their faith in a health setting, and it will go to minority groups as well.
It's because you were talking about those barriers that I thought, before I go into my other questions, I actually want to ask you a sort of side questions. How difficult, or was it easy, to find funding for this particular project?
No, it wasn't easy. I mean, trying to get research funding is not easy anyway. It's quite a competitive process, but especially when you're talking about a group that there are mixed feelings about Muslims in the UK. Often there are lots of stereotypical ideas about,
particularly now,
particularly now. But they've always been there. But I think now it's particularly strong. We got this funding back in 2010, so it was a while ago, and we did the project between 2010 2013. But then since then we've been trying to promote it, and it's been taken up in Leeds now. So the funding was not that easy to get, but we eventually managed to get it, and we managed to do the project.
And this is NHS funding?
So it's from the Department of Health through an institute called the National Institute of Health Research.
Yep.
It's national funding.
NIHR,
yes, yeah.
Okay.
So it's national funding. It's a very competitive process to get it.
Yes,
so it gives the research a lot of credibility, because it means that somebody has really looked at this proposal in a lot of detail about what we wanted to do. They've made sure that the science is correct in it, and that there's no flaws in the science.
What made you want to do this particular piece of research?
So as I said, I know that there are particular problems with depression in Muslim communities, longer periods of depression, less help available. And from my own PhD, I knew that there's a kind of a mismatch between how Muslims see their religion and how people in health settings might see religion. So I wanted to really make health services a bit more inclusive and a bit more welcoming and understanding of what religion means to Muslim patients.
No, I think this is a great idea. I mean, I can't tell you how thrilled I've been to read the booklet, the self-help booklet that we're going to be talking about soon. And I'm certainly hoping that those of you that are listening to the programme, if you feel you want to ring in and ask questions about the self-help booklet and how to get hold of it, we're going to share that anyway with you. But please feel free to ask questions on there if you feel that would help you. Tell me what we mean when we talk about therapy, because this is about therapies, isn't it?
Yeah, so the research that we did was really about how to get support from health services. So therapy is the kind of support you would get for depression in a health service. You know, you might get support from your friends and family, you might get support from a voluntary sector organisation, but when it's a kind of a structured support following a standard way of delivering it, so we have a manual for therapists, for example. So this manual is what the therapist would use to make sure that they're delivering what we say is the best way.
And this is a national manual?
So yeah, this is available on the internet. Anybody can download it. Any therapist who wants to learn more, or anybody who wants to learn more about how to treat depression in Muslim communities can download this off our project website. So therapy is a more structured way, and somebody with depression who got therapy would probably go at regular intervals. We say a minimum of 6 sessions with a therapist for this approach. And up to 12 in the NHS, although some therapists see people for longer than that too.
When we talk about therapies, are we just talking about talking, or are we talking about people who will also be on medication, or is this a pre-stage to medication where people may benefit from these therapies?
So what we've developed is a talking therapy, but people on medication can also take medication and have talking therapies, or they may have the therapy before they've actually been put on medication.
So for anybody, really?
Yeah. So I mean, I think the only people that we said it wouldn't be appropriate for, and this was based on the original version of the treatment, is people who have got another condition apart from depression, and that's the most important condition. So if somebody had, for example, PTSD, which is like a post-traumatic stress disorder, or if they had obsessive compulsive disorder or schizophrenia or psychosis, and that was the main thing that needed to be treated, but they had depression as well, then the advice from the person who developed BA is the original therapy is that's the original therapy, behavioural activation. Their advice is to treat that other condition first.
Right.
So only if depression is the main thing that needs to be treated, that's when you'd use this therapy.
Okay. We have therapies in the world, we have therapies in this country. Why are they not already meeting the needs of the Muslim community?
Well, I think some do try to, but in the UK the problem was that there was no consistency. People were doing different things. So when the Department of Health and NICE are saying you need to deliver culturally appropriate treatment, people interpret that in different ways.
Okay.
So we know that there are faith-adapted therapies in different parts of the world. We drew on a lot of that evidence when we developed this approach, and we wanted to see what other faith groups were doing. There's a lot of evidence around Christianity and mental health. There's some evidence around other faith groups like Buddhists or Jewish people, and some evidence around Muslim people, you know, who had mental health adapted with faith, but not in the UK. So we wanted to see.
And they've been successful.
So the evidence is not very. It's a bit mixed. You know, there's some studies that are better quality than others. A lot of evidence out there isn't very strong evidence.
Is that just because there's a gap in research again?
Yeah, I think it was a research gap, and that's what we were trying to fill really, with some strong evidence based on all the existing research, but also speaking to people in the UK, people who are service users, people who are managers, people who are therapists, experts in this area. And then actually developing it and testing it. So we tested it with 19 people in Bradford.
Okay.
Yeah.
So what's happening with because this is the booklet we're actually talking about that you've developed, isn't it? It's called the self-help booklet, One Step at a Time.
So we developed two things. One was the manual for therapists.
Yes.
And then this is a self-help booklet for the actual person with depression.
So anybody can really download this if they wanted to already. Where do they go to download it?
So we've got a project website. If you type in Google Depression Muslim Leeds, it will come up. It's on the University of Leeds website.
Okay. And if they also put in your name and...
If they put in my name,
so,
yeah.
Ghazal Amir and...
Depression.
It would come up, yeah. And I believe it's also, in fact, I know it's already available in Urdu as well.
Yeah, so we had it translated into Urdu. We wanted to get it translated into Arabic as well, but we didn't manage to get that done during the course of the project.
Yeah.
We'd still like to do that, actually, if there's anybody out there who can offer to do that.
Oh, so you're looking for somebody who can translate it for you?
Into Arabic, yeah.
Okay,
yeah.
all right. Well, anybody out there that's able to help with that, please get in touch with Dr. Ghazal Amir. That's really helpful, thank you. I know we're going to go into a bit more detail about this as the programme goes on, but I want to keep on track with some of the reasons behind it and the benefits of it. So this is basically a therapy that's been adapted from the generic therapy that's out there, or is it specialist therapies? I'm not sure the terminology for this.
Yeah, so most people have heard of CBT.
Cognitive behavioural therapy?
Cognitive behavioural therapy. That's the standard therapy that's often delivered in primary care.
Yeah.
But this is the B part of CBT. It's called behavioural activation. So it very much focuses on behaviour.
Okay.
And the reason we thought this was a good therapy to adapt is because it's got the same strong evidence behind it. We know it works. Some people in primary care are delivering it already. But the different thing about this is that it really focuses on client values, on the values of the person with depression.
So is that where faith practice?
So that's where we thought it would give a way in for us to start thinking about how faith values could be addressed.
Okay. So lots of therapists out there aren't Muslim. Do they need to be Muslim to deliver this kind of therapy?
So this was one of the questions that we asked in the research. We wanted to find out what people thought about that and what the research evidence said. And the conclusion that we came to after talking to everybody and looking at the research evidence is that most people, I mean, some people like to have a choice about it, and it's important to give people that choice.
Because not everybody wants to go into the religious side of things, do they?
Well, not just that. Not everybody wants to see a Muslim therapist.
Right, okay.
But then again, some people actually do want to see a Muslim therapist. So it's good to have the choice, but most people thought that wasn't the most important thing. They thought the most important thing was that the therapist was professional, respected the boundaries, and also respected their values and their religion, if that was important to them. We did find, for example, some people reporting that even when they saw a Muslim professional, because they were both Muslim, they could feel that the professional boundaries weren't always respected. So one person went to the doctor, and the GP told him he should get married as a as a kind of a cure for his depression,
Okay.
which is clearly, you know, that's nothing to do with how the GP was trained. But then other people reported that, you know, they didn't feel they were understood by a non-Muslim therapist. So there were pros and cons both ways. With a Muslim therapist, people felt they could be understood, but then sometimes they were worried about being judged and they were worried about professional boundaries. With a non-Muslim therapist, people felt they wouldn't be judged so much, but they did worry about being stereotyped and not being understood and having to educate that person too much.
I've spoken to people who've said to me that when they've been in therapy, they've spent more of their session having to explain culture and religion than actually getting the support that they were hoping for.
Exactly.
So I guess that fits in quite well with that.
Yeah.
So how then is this self-help booklet? Because it sounds to me then this booklet is actually for the therapist to use.
Well, it's for both, really, the therapist and the client. It was developed for the client, but obviously the feedback that we got was that it would be helpful for the therapist to know something about Islam, so they're not confusing Islam with Hinduism or Sikhism, for example, or Judaism. You know, that there's some basic knowledge of Islam. So what this booklet does is bring together Islamic teachings that actually are parallel to what the therapist is trying to do. So the therapist in this approach is trying to get the person to be active, to be more active as a way of, reducing their depression. Or it could be that they're trying to get them to be less active to reduce it. So if somebody's just withdrawing and in bed all the time, then they'd want them to get active and actually start doing things that would help them feel better.
Yeah, because so when you're talking about the behaviours, you're very much talking about how you behave when you're depressed and how you can use the therapy to then actually move forward in your life. So if you're somebody that stays in bed and withdraws from family, withdraws from work or society, it's about how can we encourage you to be more proactive in moving forward. And then if you're somebody that's keeping yourself too busy in order not to deal with the problem, then it sounds to me like this is a way to sort of help you to reflect on how you can make that more manageable as well.
Yeah, so behaviours that are actually causing your depression to continue, what the therapist will try to do is get you to look at changing those behaviours and actually getting you to be active in line with your values. So, for example, if somebody was not getting out of bed, didn't feel motivated, and just felt that, you know, they just wanted things to sort themselves out, basically, to feel better, but without actually doing anything themselves. The therapist would try to motivate them, try to get them to take some responsibility for getting better. So what we did in the booklet was try to find an Islamic teaching that was similar to what the therapist wanted to do. So we found the hadith about tying your camel.
All right, okay.
So the hadith says that a Bedouin came to the Prophet Muhammad ﷺ, and the Prophet Muhammad ﷺ saw that he hadn't tied his camel up, and he said, tie your camel, and he said, I rely on Allah. But the Prophet ﷺ said, tie your camel and then rely on Allah. So relying on Allah is important, but you've got to do your part. You know, you've got to take responsibility as well. And so that's the same message that the therapist would want to be getting across anyway. But having that message from an Islamic teaching could be more motivating for somebody for whom religion is important.
Yeah, so it is about the reminders that we often need. Because some people readily turn more to religion when they're in a bad place or not coping well, and they'll read more Quran and they'll study more hadith. And some people, because of the depression, maybe actually doing less of it or not being there in the first place. When we talk about depression, there was a time when I worked in the NHS and the voluntary sector where we had to think of how to describe depression in our languages because it didn't often exist as a word. Now everybody knows the word depression. But I also wonder how much we stereotype and stigmatise people because of this. So how should we be supporting people who are dealing with depression? Because I think we're not a very sympathetic community all the time on these issues. Everybody's saying they've got depression.
I think there's a lot of, there needs to be more knowledge within our communities about what depression is. Sometimes people don't see it as an illness, but it is an illness. And you know, if somebody breaks their leg, for example, we'd have more sympathy than for somebody with depression, just because we can't see the physical effects of that. But having depression can be just as disabling as having a broken leg. People sometimes feel that they simply can't move even because they're feeling so down and so stuck in the kind of way that they're feeling.
And their self-esteem and confidence is in a very different place, isn't it?
Yeah. And one of the teachings that we put in the self-help booklet is the hadith about the Prophet Muhammad ﷺ when his son died and how he cried, you know, and he didn't try to stop his expressing his grief. so the feeling sad is a normal human response.
Absolutely.
And it's from the mercy of our hearts that people do, you know, shed tears.
Sure.
But it's when you get stuck in that, when you start behaving in ways that actually keep you feeling sad,
That downward spiral.
getting into that downward spiral, that's when you can start becoming depressed. So I think in our communities we need to be more sympathetic to people. And the other thing that adds to the stigma is when people say that if you were a better Muslim, if you practice your faith properly, then you wouldn't have depression. But I think that's
such hurtful things to have to say to somebody, aren't they?
And you know, what we try to get across in this booklet is that these difficult things that happen in our life, such as illness, and depression isn't a mental illness.
Is an illness,
These are tests from Allah. And we do have the strength to overcome them.
Well, Surah Baqarah tells us, doesn't it? Allah doesn't test you with more than you can bear. So
exactly,
we just have to dig deep sometimes, don't we?
Yeah, exactly. Yeah. So the teachings in this booklet try to give people hope and to be soft, you know, not hard on themselves, to be forgiving towards themselves, not to focus on things that might actually make their depression worse, but to focus on those religious teachings that will actually help them to feel better. And
your booklet, mashallah, absolutely reinforces those messages, shows those evidences for those things as well. And that's why I think it's particularly such a useful tool for our communities and therapists, like you say, to be able to use.
We really hope so. I mean, we've had some really good feedback from people with depression who've used it, and from some therapists. I think therapists tend to have, because they're not really trained in this area, they can sometimes feel a bit uncomfortable about using the booklet.
Yes, I'm not surprised to hear that. I am wondering when we're talking about this, how actively this is being used and how we can expect it to be used, because it's fairly new still that it's being picked up.
Yeah, so in Leeds it is being delivered within Touchstone Mental Health Services. Okay. A lot of other areas have actually expressed an interest in delivering it, and the thing is that they do need support to deliver it. So one of the things that I'm offering as a way of getting it out there into the services is to train any teams that would like to take this up.
So that's something you can offer personally?
Yeah, and people within, you know, people who have used this approach before may be also able to help with that too. But I'm certainly offering that training to any teams for free. You know, it's something that I want to get out there. The feedback has been so good from Muslim service users that I think we need to do all we can to make it available to them.
So people just need to contact you at the University of Leeds?
Yeah, if they want to get it into practice, if they want the training, and it needs to be training for a whole team, because one of the things we found when we did the pilot study in Bradford was that we were training people from different teams, so individual people, and that meant that they weren't getting much support from within the team. Whereas if we train the whole team, then everybody's aware of it, everybody can support each other, their day-to-day support would hopefully be there. And I'm also very happy to provide, you know, any support from the research point of view that people might need too.
Okay, that's really helpful to hear, and Jazakallah khair for sharing that. In terms of the community that's out there who themselves might be watching this programme and thinking, well, I suffer from depression, how do I get my doctor to take this on board, or who do I go to? Is it their doctor that they should talk to about this?
Well, some primary care mental health services are, you can self-refer to them. I think in Bradford, when we did the pilot, you could go through a group called Sharing Voices, which was also involved in the research, and ask them to refer you. So if you know of a voluntary sector group around that you know you trust and you feel that they will take you seriously, you could ask to be referred through them, or you could try to self-refer. If that's not available, then do ask your GP. I think the more people that say they want this therapy, you know, the more chance there is that it will be offered in their area. So
how should they be phrasing this to their doctor? What should they be specifically asking for?
I think it might be a good idea to download the booklet,
okay.
Or to
showing you the booklet again.
And take it to whoever you want to, you know, ask to refer you, or you can just download the project, you know, the information from the project website, and just take that print out and say, this is the therapy that I would like to try.
We need to take a break, I'm afraid. It's so fascinating, and I want to go into this in more detail, but inshallah we'll be back with you after the break. Assalamu alaikum wa rahmatullah.